My name is Basim Uthman. I'm professor of neurology, clinical neurology, and clinical neuroscience. Normally it is mild to moderate in intensity, and it does not prohibit activities like in migraine. So it is usually a constant pressure-like headache where it's like a headband around the head, not just on one side like a migraine. It is bilateral and diffuse, and it can have nausea but no vomiting. You can have associated phonophobia or photophobia, but not both. Sometimes you have that spectrum of migraine tension. The tension headache normally would be lower intensity in the morning or not existing in the morning, and may get worse towards the end of the day. We normally treat tension headaches with again, over-the-counter medications such as aspirin or paracetamol or some other combination drugs. And of course, we have to look at the stressors that can cause this tension headache, and that would help a lot. It is a brief, lancinating, lightning-like pain that is typically in the either maxillary or the mandibular division of cranial nerve number 5. It is normally triggered by mouth activity like breathing, chewing, brushing the teeth. The neurological examination is normal, and the trigeminal neuralgia does not awaken the patient from sleep. Normally, we treat patients with trigeminal neuralgia with anticonvulsants, in particular carbamazepine. In a young patient, when trigeminal neuralgia happens, we always, as neurologists, think about possibility of association with multiple sclerosis. So if there are any other neurological symptoms, you have to go to the doctor and seek medical attention. Now, at times, the trigeminal neuralgia may be, in fact, confused with dental problems. So it would be a good idea also to go to the dentist and have an examination, oral examination. If you have a headache for the first time after age 50, if your headache is worse upon awakening and gets better after you wake up, if the headache is the worst in your lifetime. Now, once again, you could have migraine headaches, and one of the headaches could be the worst in your life. But what I'm talking about is like severe thunderclap type of headaches. This is another red flag where you need to go to see the doctor. If there is a change in the character of the headache, it's not the usual headaches that you normally have. If there is any history of cancer in the patient and now they're having headaches. If there is fever and stiff neck. If there is visual loss. If there is double vision or a change in personality. Or if there is new onset seizures. These are all indications that you need to seek medical attention very soon. Now, we could spend another hour to talk about why in each one of these situations. But there are several things that can happen in the brain, whether it's inflammatory processes or mass lesions or bleeding in the head or increased intracranial pressure because of either increased production of CSF, this is the cerebrospinal fluid, or obstruction of the cerebrospinal fluid, or because of any other endogenous process in the brain. A neurological evaluation is necessary so that the underlying etiology, and that's why we call it secondary headaches. So the underlying etiology would be identified and treated, because the headache, again, is not primary, it is secondary to that other problem. The outcome of these situations depends on the underlying etiology. They can check for any meningeal irritation, any edema when they look into your eye with their ophthalmoscope, any enlarged blind spot they can test for, and this needs expertise to do. Any loss of visual acuity or tender temporal artery here, especially in older people. That could be a risk factor, actually, for blindness in those patients who are not treated sooner than later. Okay? If there are any focal neurological findings and if there is any alteration in arousal. All of these can be figured out by a neurological examination when you go see the doctor. So it is very important you seek medical attention early when any of those things that I talked about in the red flags.